Hi, sir. Welcome to the IRS. How can I help you?
This is for taking on my duelist. Oh.
Alright, we got BSI on, scene is safe, police are around. Shooter, we don't know where he is.
Mechanism of injury, got a gunshot wound to the right side of the chest. Seems like the patient has a broken arm. A number of patients, there's one patient. We're gonna call for additional resources, ALS, and looks like C-spine is needed. Patient is on the ground, suspect is C-spine. Hey partner, you mind holding inline C-spine?
Yes, sir.
General impression, the patient is unconscious, lying supine on the ground. He has blood coming out from his right side of the chest. Seems to be a broken open fracture to his right arm with the bone sticking out. And level of conscious, he is unconscious. All right, we're gonna assess X. Patient has a gunshot wound to his right side of his chest, so I'm gonna cover it with my hand. Partner, do you mind covering this hand? Covering the whole thing, your hand on the count of three.
I got
1, 2, 3. I'm gonna grab my four-sided occlusive dressing, place it over the pole. On the count of three, I'm gonna place this over his chest. 1, 2, 3. Place that there. Keep that there.
3.
Patient is spurting out blood from his radial bone, so I'm gonna apply a tourniquet proximal to the injury. Be careful not to go over any joints. Good. Tighten it. Store this around there. And T for time.
Since the patient is having a suspected C-spine injury, we're going to do a jaw thrust. Okay, his airway looks patent. And since he's unconscious, we're going to add an OPA.
At this point, we're gonna assess his breathing. Rate and depth seems to be fast and shallow, and with unilateral chest rise and fall. We're gonna also state his lung sounds. We have diminished lung sounds on the right side, so I'm gonna go from a four-sided chest occlusion to a three-sided, so that we're able to burp him.
Alrighty, and then I'm going to add a BVM at 15 liters of oxygen per minute, and I'm going to squeeze it once every 6 seconds.
Assessing the circulation, we're gonna check his radial pulses. He's got no pulse on the right arm and weak on the left. We're gonna check his skin signs, and he is pale, cool, and diaphoretic, so we're gonna treat for shock and give him a blankie to treat thermoregulation. We're gonna consider this patient priority 1, stat. ALS has arrived on scene. They're gonna be at the head of the patient and BVM.
I'm going to now put on the C-collar. I measured it out beforehand. There we go. Slightly kind of lift your head a little bit. So. Make sure it's maintaining C-spine. Alright. It's all set.
I'm gonna do the rapid exam at this point. I'm gonna check his head, check the back of his neck for any forms of crepitus. I'm gonna check his chest. We have put an occlusive dressing here. Gonna check his abdomen. No other ear injuries there. Gonna check his right arm, pulse. The bleeding has stopped. Gonna check his left arm. There's no bleeding there, nothing to worry about. Gonna check his pelvis, open and close the book. Gonna check his right leg and his left leg. No other apparent injuries.
3.
Alright, I'm checking his spine, assessing for any exit wounds. There doesn't seem to be any, so we're going to lay him back down on the backboard.
On the head count of 3.
1, 2, 3.
Our patient is on the backboard and strapped and secured. Straps are tight. We started with PMS, and we did the chest straps first, the thigh straps, the legs, and the head last. We're gonna check PMS one more time, and we're gonna pad the voice. We're gonna transport this patient to trauma center level 1. Already pulled the coworker from the IRS department. Sir, I'm gonna ask you a few questions, that's all right?
Yes.
Signs and symptoms, we got bleeding and open wounds. Do you know if this patient has any allergies?
He does not.
Do you know if he's taking any medications?
He does not.
Do you know if he has a past medical history?
No, I don't know about that.
Do you know when he ate last or had any fluids?
He had a big sandwich for lunch.
And do you know what the events leading up to this was?
He was working at his desk and then someone came and shot him.
At this point, we're going to treat the secondary injuries. The open wound to his radial bone, we're going to apply sterile dressing and sterile gauze. We're also going to apply a SAM splint and wrap and assess PMS, and we're going to reassess every 5 minutes.
All right, guys, now we're going into our secondary assessment. I'm gonna feel around his head, palpating everything, make sure everything's okay with his scalp, his eyes, and his nose and all that. Then after that, I'm going to check his trachea and his neck. I'm gonna check his cervical spine, making sure that there's no bone sticking out or anything protruding. And then after that, I'm gonna go down to his abdomen and check his thorax and his pelvis. And I'm also gonna check if he can open and close his book, which he can. Awesome. And we're also gonna move over the genitalia area as well. And then also we're gonna do the CSM, just a quick little check with his arms and his legs. We're going to feel both bilateral pulses. Okay. Doesn't seem to have one on his left, but there's one on his right, which is good. And then we're going to, sir, can you feel what finger I'm touching? No response. All right, so negative on that. And then we're gonna go down to his legs as well. Sir, can you feel me touching you? No? Sir, can you wiggle your toes for me? No? Alrighty. And then I'm also gonna check his Babinski reflex with my trauma shears. Oh, thank you. I have them in there, but they're just stuck. Alrighty. And there seems to be no response from his Babinski reflex.
Go. Alrighty, so the pathophysiology is going to be a GSW to the right chest, resulting in a open pneumothorax, which allow air to build up in the chest cavity and can progress to a tension pneumothorax. Open fracture to the radial bone, which can potentially lacerate a artery and lead to hemorrhagic shock and hypovolemia.
Go.
All right, our diagnosis is a gunshot wound to the right side chest, which collapsed one of the lungs, and a broken radial bone, which resulted in an open fracture.